All right, good evening, everyone. I call this October 28, 2025 hybrid administrative meeting of the Board of Commissioners to order. We will have a moment of silence followed by the Pledge of Allegiance led by Madam Clerk Michelle Kavanaugh.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Madam Clerk. Madam County Manager, are there any changes or additions to the agenda this evening?
Thank you, Chair. Yes. We're asking for a deferral of item 4A on the Summer of Nonviolence Recognition presentation of recognition to be deferred to the November 18th meeting. And then we're asking for suspension of the rules for 9A County Clerk Robus Asted Ballot on Demand System 2025 City of Albuquerque runoff election item sponsor is requesting suspension of the rules for final adoption of consideration and to be moved to consent as agenda item 6L. A vote is required for the above actions to the agenda.
Thank you, Madam County Manager. Commissioners, are there any changes from the dais this evening? Not seeing any. I would make a motion to suspend the rules and assign the item to the consent agenda and to defer item 4A.
Second.
Second from Vice Chair Barboa. Any discussion? Yes, Commissioner Benson?
I just want to repeat what I've said before. We suspend rules every meeting, it seems like, because we need to get things done. So I definitely support this, but I think we should consider to remove the rule altogether. Thank you, Mr. Chair.
All right, thank you. Seeing no further discussion, all those in favor signal in the affirmative. Yes?
Yes.
Aye.
Any opposed? That passes on a 5-0 vote. We have an agenda. So first up, we have item 4B, which is now 4A, the recognition of Mr. Joe Chavez, and I'm not sure who's presenting this. I'm sorry, Commissioner Frank Bach. Sorry about that.
Thank you. Thank you, Mr. Chair. I know Mr. Chavez is here in the audience, his wife Isabel, and I think protocol is to have him come up to the podium, right? If they'd like to stand and be recognized. Isabel, you don't wanna go? No, she said no. We also have a member of staff, Nick Ham, who's there at the podium as well, and it's my honor and privilege, Joe, to read this proclamation, a certificate of recognition. So let me read that, then get everybody to have a chance to say a few words. So,
thank you.
So a certificate of recognition given to Joe Chavez in sincere appreciation and recognition of your exceptional commitment, tireless efforts, and invaluable service to Bernalillo County and its residents. You have served our community for many years with integrity and passion through your involvement in numerous volunteer roles for the city and county, including the Bernalillo County Arts Board, the Bernalillo County Planning Commission, the Extraterritorial Land Use Commission, and the Bernalillo County Charter Commission. Your thoughtful contributions and have helped shape policies and plans that continue to guide the responsible growth and development of our region. Originally from Santa Rosa, New Mexico, and a proud resident of South Valley for over 35 years, you bring a spirit of leadership, entrepreneurship, and community-mindedness to everything you do. As principal of Chavez Promotions and SRD Detailing, you balance professional excellence with a strong sense of civic responsibility. The Bernalillo County Board of Commissioners extend this gratitude to you for years of devotion and tireless advocacy on behalf of our community. Your work has left a lasting impact on our county's future, presented this day, October 28, 2025. So, thank you, Joe, very much for all your service. I would like to just say from personal note, I've known Joe for about 35 years, I think it is, and I've known him to reflect exactly what is in this proclamation and really commend you for all your service. I'd also like to thank our staff, Nick Hammond and the others, and I know the members of the Planning Commission are here, and I'll let Nick speak to that perhaps in a few minutes, but I really appreciate your advocacy when I've come on board here, and I just asked how are things going at the Planning Commission. I've heard nothing but high marks and good regard in terms of your involvement, your participation, so thank you all for your years of service. So if I would like to get a round of applause for Joe Chavez. So, Joe, I don't know if you have any remarks, if you'd like to, and I'd like to ask, perhaps after you, for Nick to say a few words as well.
Okay. Thank you very much, Frank. Really appreciate that, and I've enjoyed my stay here. I was in the Planning Commission for 16 years. That's a long time. I was 8 years on the City Planning Commission, and I was 6 years on the chairman of the Arts Board for Bernalillo County. So I've enjoyed that all my life. And I especially want to thank the commissioners that are here today, my fellow commissioners, Chavez and Silva. And I also would like to recognize Mr. Grotti, which was our planning director and guided me through so many years in the Planning Commission. So I want to thank him and Mr. Lamb too for all the work they do at the Planning Commission. I know it's a first-rate organization. They get things done, and always enjoyed working with him. Thank you very much.
Thank you, Joe. Thank you. Nick, did you want to say a few words?
Thank you, Mr. Chair, Commissioner Baca, members of the commission. Honored to be able to contribute to recognizing Commissioner Chavez. For as long as I can remember, Commissioner Chavez was a planning commissioner. The Planning Commission is asked to do difficult and important work, to make recommendations to you all, to make final determinations about certain cases, to hear appeals. What I can say confidently is that under Commissioner Chavez's leadership as chair, as vice chair, as a member, the Planning Commission did excellent work. Commissioner Chavez represented his community with passion, with a ferocity that demonstrated how much he actually cared for the people that he thought were important and that he worked for every single day. And to do that work well, you need to conduct a process that is just, equitable, and thorough. And I can say unequivocally that Commissioner Chavez contributed to that over the years. And on behalf of myself, staff, both current and past, we are very appreciative of the work that you've done.
Thank you. Just one last comment. I'd like to thank probably the most important person that has helped me and put up with me for so many years on so many commissions. My wife, Isabel Chavez. Yeah. Thank you, commissioners.
Commissioner Baca.
Mr. Chavez, I just wanted to thank you very much for your service. I personally have been in front of the County Planning Commission and the Environmental Planning Commission, and I think as a worker, as a planner, and I think that our CPC is top-notch. It is one of the most difficult volunteer boards that we have here, I believe, and thank you for your stick-to-itness, and thank you, Isabel, for sharing your husband with us. Thank you.
So, Joe, we have a plaque I'd like to present to you. If you want to come forward, we get a picture.
All right, up next, we have the I Voted Sticker Contest, sponsored by Commissioner Walt Benson and Madam Clerk Kavanaugh.
Thank you, Mr. Chair. I understand we've got some artists here in the audience. Can you come on up to the podium here? Thank you. All right, I'm super excited to read this acknowledgement, but I just want to thank you all. I love this this tradition we have young artists who create the I voted stickers, and Madam Clerk Kavanaugh has this the full size artwork up there, and we've got stickers right here, but it's excellent to see you guys get involved, put your heart and soul into your drawings, and then knowing that our voters are putting your artwork on their chest after they vote. It's pretty cool. And it helps get people involved in the democratic process. So I'm going to read an acknowledgement, but then, Mr. Chair, I'd like to hand the microphone to Madam Clerk afterwards for a few words. The talented APS students for the new collection of I Voted stickers. Acknowledging the I Voted stickers initiative designed to encourage election education and community engagement among youth through artistic expression, and acknowledging the overwhelming popularity and demand of the I Voted stickers. Contended 6 new designs be released for the upcoming 2025 regular local election, and acknowledging the partnership with the Bureau of Elections and APS. Over 200 designs were submitted by visual arts students from kindergarten to 12th grade. And acknowledging 18 finalists were chosen, whose designs are featured on stickers distributed to Bernalillo County voters as they cast their vote in the 2025 regular local election. Now therefore be it resolved, the Bernalillo County Board of Commissioners and County Clerk Michelle S. Kavanaugh acknowledges the artists chosen for the I Voted stickers for their artistic talent and gift shared with the electorate of Bernalillo County. Done this 28th day of October 2025 in Bernalillo County, State of New Mexico. Presented this day, October 28th, 2025. Signed the Board of Commissioners. Thank you so much. We're gonna embarrass you guys a little more and have you come up here, but first, Madam Clerk.
Thank you very much, Mr. Chair, Commissioner Benson. I'm so excited. I am so excited to get to meet you all finally. Running elections is pretty great. That's, a really neat part of this job. But I got to tell you that this whole project, the I Voted sticker contest, has to be the most excited that I've been in my job in the last 5 years. It was so much fun. I don't know, where did Crystal go? Crystal? Oh, hi, Crystal. We got to go through these, and Nathan, we got to go through all of the artwork last year and this year, and getting to see the incredible talent that you all showed was the absolute most fun thing that we've ever gotten to do. So thank you very much for participating. Thank you for truly, as Commissioner Benson said, putting your heart and soul into this artwork. And, I'm old. I'm not going to try and deny that anymore. I'm old, and my own kids don't listen to me. So I don't know how I would think that, other stranger kids are going to listen to me, but they'll listen to you. They'll listen to you. And when kids talk to other kids, it means something. And so I am really excited that you all did this. This has been the most interest in elections that I have seen ever, I think. The news stations have been beating down our doors to take pictures, to do interviews about your stickers, to the newspapers have interviewed us about your stickers. I mean, I don't know how many of you have seen your stickers on the news. Have any of you seen the news? Yeah. I mean, they are constantly asking to interview us about your stickers. So you all are celebrities, even if you didn't realize it. And we're going to keep doing this year after year. So I hope you guys participate again and encourage your friends to do so as well, because it has been a great, great program. And we really, really appreciate everything that you did and for participating. So congratulations. And we have some certificates for you. So if you don't mind, I'm going to come down there and get them handed out to you all.
And
So
come on up.
thank you.
Let's have a picture. Come on up here to the front.
And actually, Commissioner Benson, real quick, I did want to recognize that we have Superintendent Blakey in the audience. I don't know if she wanted to come up and say a
Yes.
few words about this, but we're honored to have her here tonight.
Thank you, Chair and Commissioners. We are so proud of our students. As you may or may not know, we have art every year for our students in school. And so for them to be able to connect what they're learning in school and their creativity with this project is really exciting to see. And as a former social studies teacher, I also am just really excited to see students invested in the voting process at such a young age, and how proud you guys must be to see all of us old people wearing your stickers around town. So get out this weekend and you'll see even more when you go to the grocery store and everywhere when people vote, and then certainly next week. So I can't imagine how proud, and I hope you guys know you should be really proud of yourselves. And thank you so much for the partnership with the county clerk and with all of you to have our students share their talents and promote voting in our city. So thank you all so much.
Do you guys want to come up this way? Good job. Thank you.
Good job, guys.
So inspired.
All right, thank you very much, Madam Clerk, Commissioner Benson, and of course to all the wonderful young artists here with us this evening. All right, before we get to public comment, I'm going to read a couple of statements into the record regarding the closed meeting we held this afternoon. I offer the following statement regarding the closed meeting held Tuesday, October 28, 2025 at 4 p.m. Only those items described on the published notice and agenda for the closed meeting held on October 28, 2025 were discussed at the closed meeting. I need a motion for approval of this statement, and it will become part of the minutes of this meeting.
So moved.
Second. Any discussion? All those in favor signal in the affirmative. Yes?
Yes.
Any opposed? It's adopted on a 5-0 vote. And the second statement, I move that the county manager and the county attorney be authorized to proceed with the matters discussed in the closed meeting held on Tuesday, October 28, 2025, within the parameters set by this commission in the closed meeting agenda. So moved.
Second.
Second from Commissioner Barbara Baca. Any discussion? Seeing none, all those in favor signal in the affirmative. Yes.
Yes.
Any opposed? Passes on a 5-0 vote. We will now move on to public comment. Each person will have 2 minutes, and you'll be alerted to your remaining time. When your name is called, please make your way to the podium if you're speaking in person. Before making your statements, please state your name for the record. To maintain order and decorum and in the spirit of professionalism and respect for everyone present, speakers must adhere to the 2-minute time limit. If the conduct of the presenter violates the rules, they may be subject to removal. Javier, could you please call the names for the evening?
Thank you, Mr. Chair. This evening, we have a total of 10 speakers, with 1 speaker appearing via Zoom. Please line up at the podium when your name is called, and when it is your turn to speak, please state your name for the record. We will start with Don Schrader, followed by Tad Neminsky, followed by Catherine Sanchez. Tad Neminsky.
Thank you. My name is Ted Niemiecki. I want to speak a little bit about history of New Mexico. New Mexico became in the early 1900s, exactly 1912, joined the Union and became one of the 50 states of the United States of America. Same time, joining the Union, New Mexico must accept United States Constitution. So, United States Constitution falls under only United States federal government. There is no state sovereign nation who does, or city or state does immigration law. All immigration under the state. If you come here, we have 2 immigrants group. Biggest one, legal and illegal, simple as that. Why? And it's also sometimes those are rules. 2 and 5 years minimum to become citizen. So why no president can overrule these laws or any country or state, city.
Catherine Sanchez, followed by Olga Santana, followed by Rosalio Hernandez.
Thank you, Commission. My name is Catherine Sanchez. I'm an attorney at Greenspoon Martyr, and I've been asked to appear at this hearing. It's concerning the property. I believe the condemnation on the 4303. I don't know if it's appropriate I speak now. It's on the agenda.
Yes, this is public
Okay,
comment
this is
period.
it. Okay, so I know that there have been hearings and missed hearings by my client, First Citizens. I just got notified of this hearing. This was in foreclosure in 2021, and the judgment was entered, and we proceeded just with the eviction. So when I got notice of this, I contacted the city zoning department, went out and I saw that property, connected with my client. It was difficult, but I was able to get hold of the client. And I can confirm that both the house and the garage on that property could be maintained. My client has made a promise within 2 weeks to get somebody to board up all the windows, the doors so they can start in the interior. And their hopes up that with the interior being renovated, that they'll be able to transfer the title either via third-party purchaser or through conveyance to HUD. I spoke briefly with the city here, the planning officer, director, and I think he indicated that if I keep them abreast of the situation with that deadline, that you might consider that proposal or deferment to another hearing possibly to allow my client to proceed. And that's all I have.
Olga Santana, followed by Rosalio Hernandez, followed by Virginia Cantua.
Good afternoon, Chair and members of the Commission. My name is Olga Santana. I am a worker rights organizer with El Centro de Igualdad y Derechos, a proud immigrant mother and a contributor to our state economy. We are here today to support this ordinance because a few months ago, I opened my food business. However, due to the current political climate across the country, especially around immigration, my family and I decided to close it, which affected our household income. We also didn't feel safe continuing because we feared that because of our appearance, we could be detained. Sadly, this administration has carried out racially motivated detentions, and I know my situation is not unique. I have colleagues who have also closed their businesses out of fear of ICE's presence. And this clearly affects not only our families, but also the city's overall economy. That is why today I ask that this ordinance be approved so that the entire community, including small business owners, can feel safe wherever we are, without fear of being separated from our families. Approving this ordinance will bring peace of mind to our community, allowing people to live their daily lives, go to the grocery store, school, church, or clinic without fear. I support this ordinance for the safety of all business owners and our community. Thank you.
Rosalio Hernandez, followed by Virginia Cantua, followed by Andres Esquivel.
Good afternoon, President and members of the Commission. My name is Roxana. I am a member of El Centro, and in solidarity, I'm going to read my uncle's testimony. My name is Rosalio Hernandez, and I am a member of El Centro. I am proud to help our community. We are always here to support in whatever way is needed. I have owned my business, Taqueria Mexico, for 30 years. It's a dream that so many of us who came here seeking new opportunities have worked hard to achieve, to own a business, to buy a home, and build a better life for our families and our community. Today, I'm here to support this ordinance because since the administration began, our community has been constantly targeted with the presence of ICE. At my taqueria, people in white vehicles wearing green uniforms have shown up, spreading fear among my customers who immediately decide to leave out of fear. Others I've seen on several occasions are about to come in but turn away and they see them. Because of this, my earnings have gone down as customer visits have decreased. People are scared and they leave. That's why today I'm asking you to approve this ordinance because it's for the good of the entire working community so that everyone can feel safer when visiting places like Taqueria Mexico. It's not right that my customers are no longer feel confident enough to come have their lunch during a workday or enjoy breakfast or dinner with their families. We need to be able to go about our daily lives without fear, and as business owners, we need to keep our doors open, continue serving our community, and contribute to the local economy while providing for our families. Thank you.
Virginia Cantua, followed by Andres Esquivel, followed by Dr. Geraldo Cianello.
My name is Valeria. I'm a member of El Centro, and in solidarity, I will read this testimony. Good afternoon, Mr. President and members of the Commission. My name is Virginia Cantua, and I am a proud mother of El Centro member. Despite many adversities, I have managed to move forward and overcome the obstacles that have come my way. I am a proud mother of a son with a disability whom I have raised on my own since my husband passed away 8 years ago. To support myself, 3 of my colleagues and I formed a cooperative to provide caregiving services. We pay our taxes on time and comply with all legal requirements, contributing to the economy of our state. Today, I am here to support this ordinance because my coworkers and I have had to stop working out of fear of being detained while going to work. We no longer know if we can continue offering our services, and even some of the people we care for have felt unsafe hiring us since this administration began. As a result, our income, the only support for our families, has decreased. I am deeply afraid that with ICE's presence, there may come a day when I don't return home and no one will be there to care for my son. That is why I ask you today to approve this ordinance so that all workers and business owners can feel safe leaving home to work without fear of not returning and leaving our families alone. We are not asking for handouts. On the contrary, we are simply asking to be allowed to work safely and without fear of being separated from our loved ones. Thank you.
Andres Esquivel, followed by Dr. Geraldo Cianello, followed by Melissa Jameson.
Good evening, Chairman and members of the Commission. My name is Andres Esquivel. I work as a campaigns manager for the New Mexico Dream Team here in Albuquerque. My family migrated here from Chihuahua, Mexico in 2001, and we have called Bernalillo County our home since then. Over the years, my brothers and I have gone to APS schools, and my dad has owned and operated an auto repair business, which has grown from running out of the driveway of our first home in the U.S. from now having his own shop off of Yale. And my mom is a strong catechism leader at a local church. I myself am a community organizer and a musician in the local scene. I highlight these things because these opportunities are only made possible for immigrant families like my own through the safety and security of our county's immigrant-friendly policies. With the recent actions of the federal government, my little brother, who is a student at Rio Grande High School, shares with me that he has fear that one day ICE could show up to his school and take his classmates, or that no one would be there to pick him up from school. My mom shares with me how the number of youth being signed up for their first communion has dropped at her church since families are fearful of ICE showing up at the church. We must ensure that our youth and communities are safe from being separated from their families, whether it's at school, church, or anywhere they gather. Please vote in support of this policy proposed by Vice Chair Barboa and Commissioner Baca, as every resident of Bernalillo County deserves safety and opportunity. Thank you.
Dr. Geraldo Cianello, followed by Melissa Jameson.
Dr. Geraldo Cianello, thank you, Mr. Chair and Commission members, for serving and allowing us to practice our First Amendment. I'm a Filipino American. I waited 9 years to be a naturalized U.S. citizen so I can vote legally. Last month, Voter Reference Foundations published voter roll data, and there's been a failed effort to block the election watchdog from publishing the state's voter rolls. A federal district court has awarded more than $800,000 in legal fees to the VRF after ruling the state violated National Voter Registration Act and engaged in partisan discrimination against the election transparency watchdog by refusing to provide a copy of the state's voter list. I wonder how New Mexico taxpayers feel about losing nearly $1 million of our money in legal fees because partisan Secretary of State Maggie Luis Oliver and Attorney General Raul Torres didn't want us to have access to public election records we are entitled to see. By making it accessible, Americans can use voterref.com website to verify their accuracy, searching for double registration, deceased voter, etc. The Secretary of State's office claimed publishing voter rolls was illegal in New Mexico. The federal court agreed with VRF. Nothing in state law prohibited VRF from publishing the voter rolls, so Democrats changed the law. Following a bench trial, U.S. District Judge James Browning censured the Secretary and Attorney General for engaging in viewpoint discrimination by punishing VRF. for daring to share its opinion about how New Mexico could improve its list, maintenance, and record keeping. He even called VRF's mission regarding the transparency of election a benefit to the public. VRF's New Mexico data went back online that very same day. A year later, the state was ordered to pay VRF over $800,000 in legal fees, which will be used to continue its valuable work. May God have mercy in New Mexico. Thank you.
Melissa Jameson.
Good afternoon, Chairman and members of the Commission. My name is Melissa Jameson, born and raised in Albuquerque. I am a very proud mother, business owner, member of a religious community, and member of many different communities in our county. And I want to thank you all very much for your support of this ordinance in the previous hearing. To me, this is about quality of life in our county and truly around the country, but specifically tonight you're taking a decision that affects the quality of life in our county. And for all of us, regardless of where we were born or what our name is or what our language is or what our status is, living in a place where parents are fearful to take their children to school, parishioners are fearful of going to worship, people are afraid to seek care at medical facilities, among many other places. That is not the kind of country that we want to live in, and that is something that affects all of us. When businesses are closing, or at least closing temporarily, so I can't go get lunch at my favorite place, you can't, go, or when you go to participate in the PTA at your kid's school, half the parents who used to always be there and participate actively are too afraid to leave their house to participate in the PTA. These are just some examples. We all know that this when people feel fearful of leaving their house, it's not good for the economy, but it's also not good for all of us as human beings. So please consider voting in favor of this ordinance to protect, at the very least, critical, sensitive places in our community. Thank you.
We will now move to our online speaker, Sarah Escobar.
Good evening, commissioners. My name is Sara Bonnie Escobar, Executive Director of Enlace Comunitario. We provide services for survivors of domestic violence. For 25 years, Enlace Comunitario has been committed to shaping immigrant-friendly policies that support the health and wellness of Latin and immigrant domestic violence survivors. We know that the immigrant domestic violence survivors face even more barriers to attaining safety for themselves and their children, including unclear or unenforced legal or law enforcement processes that perpetrators often weaponize to retain power over their victims. Enlace Comunitario supports the proposed ordinance requiring a judicial warrant to enter private spaces, anywhere that the public cannot enter, such as hospitals, schools, places of worship, and domestic violence and sexual assault providers, facilities, and shelters. As a culturally specific domestic violence service provider, Enlace Comunitario has witnessed the direct impact that ICE's increased presence has had on our clients and community members, many of whom have shared that they are living in constant fear, are not comfortable traveling to and from work, and are reducing their in-person appointments to receive services from Enlace. Some community members have even shared that they may return to their homelands given the increased prevalence of ICE and the potential for being detained or separated from their children. The xenophobic rhetoric woven into federal and local policies creates a chilling effect for survivors of domestic violence and reduces their ability to safely report abuse. When community members are constantly hearing that ICE has been spotted here and there, how are they supposed to feel safe or to seek help? Policy proposals that promote more surveillance in spaces where people are seeking services will not help our communities feel safe. Enlace Comunitario will continue to advocate for the dignity and respect of the communities we serve. We would like to reinforce that no good can come from ICE being present in spaces where our communities are receiving help.
Thank you very much, ma'am. I'm sorry, your time has expired.
Thank you.
Thank you, Mr. Chair. This concludes our public comment.
Mr. Chair?
Thank you, Javier. Commissioner
Just
Barbara
a
Baca.
point of personal privilege, and for those of you who are here or watching, the ordinance creating safer community places will not be voted on tonight. It will be voted on November 18th. Thank you.
Yes, Vice Chair Barboa.
Yes, just thank you so much for coming out this evening. Thank you for sharing your voice, braving it. I'm glad that the county is a safe place for you to be able to come and share your stories with us and your years of business and economic into our county development. So thank you.
All right, thank you very much. That concludes our public comment for the evening. And first up on our communications items, we have CEO Kate Becker from the University of New Mexico Hospital, and she's going to be presenting the first quarter report for the UNM Hospital.
Good evening, Mr. Chair and Commissioners. Thanks for having me this evening. We have our report, as usual, in your packet, and there's just a few highlights that I want to share with you. The first one, which has been the big news for us for the month of October, is that October 5th, the new critical care tower opened. So thank you to those of you who were able to attend the ribbon cutting, and very exciting, October 5th. We actually moved 132 patients from the intensive care units and the adult emergency room in the pavilion over to the new tower. And everybody got there safely, and none of the staff got hurt. So all the way around, it was just great. So that's fantastic. So, of course, we're full again, but very happy to be in the new space and very excited about that. The second thing I wanted to mention to you is you'll see in our packet our first quarter financial results. And those results show that we have a positive bottom line for the first quarter of our fiscal year 2026, which started July 1st. It is a $37,000 positive bottom line, so it couldn't possibly be any closer to break even, I don't think. But it is showing that we're going in the right direction and that a lot of the work that you heard about us doing in the spring is really bearing fruit as we came into this fiscal year. So we expect to continue on that positive trajectory. The third thing I want to mention is our community health needs assessment listening sessions continue. So we did just recently have 2 more listening sessions, one at the Mexican consulate and a second one with PNM's Vulnerable Communities group. And so those were both very successful, and we're really happy to do those. And then we have one coming up with the Pathways Navigators, very excited to hear from them in terms of their feedback and what they're hearing from the community. And another one with the New Mexico Prostate Cancer Support Group. So lots more of those coming up through the next 6 months or so. Last 2 things I'll mention. One is we do have the Children's Psychiatric Center still under construction. If you've driven by there, you're seeing it starting to actually have a shape, and you can see it looks like a building. That will be opening next year in 2026. So we're very excited for that. That's the replacement for those cottages that we had for children's psychiatric care. So this is a modern facility, much more flexible, and really great spaces. If you've been in the crisis center, which I think all of you have to visit, you know that those behavioral health spaces can be healing spaces in and of themselves. And so really excited to have the Children's Psychiatric Center joining that more modern approach. And then the last thing I'll mention in the good news category is you'll see in your packet that our patient experience scores are going up. We are really starting to see results both on the inpatient and outpatient sides from the work that's been done from initiatives like Commit to Sit, which is literally sitting down as you're talking to a patient so that you're at that eye level if they're in a bed or in an exam room, and they're able to really feel like you're spending that time and focusing on what they need. So that's the good news report, and happy to stand for any questions.
Thank you, Madam CEO. Commissioners, Vice Chair Barboa.
Hi, thank you, Director Kate Becker. I just thank you for this report. I was able to go through it. Yay to that
making over the mark. We're not below the line, right? So, yay to that. I guess, I'm sure this is the million-dollar question that everybody's asking you is what you anticipate with the upcoming budget cuts? Medicaid, I look here and I see Medicaid is 38% of the revenue. Is that what I saw? 36?
Yes, ma'am. 36% of our revenue is Medicaid. So the one big, beautiful bill, OBBA is what we've been calling it, but that's not very flexible. But the bill has a couple of impacts that we know are coming up. The first one actually starts this weekend, which is the change to subsidies for folks who are on the health insurance exchange. We don't anticipate a really significant impact from that change. The first really big impact we're going to see is going to be January 1st of 2027, when the Medicaid eligibility rules will change. The Healthcare Authority for New Mexico is currently estimating about 100,000 folks will lose their Medicaid coverage at that point. That may change a little bit between now and then, but that's probably directionally pretty close. So what we've done first is look at, for our UNM Care program, you can see in the report, the last year we floated between about 4,000 and 6,000 folks who are enrolled in UNM Care. So what we did was look back to before the Affordable Care Act was enacted to see what was the scale of that program. It averaged between 30 and 35,000 people at that time who were on UNM Care. So we are expecting to see an increase in that program post those changes January 1 of 2027 to be about 5 times the size that it is now. So that means as we go into this winter and doing our budget for fiscal year 27, because that change will be halfway through the year, we're going to be planning in our budget for how we address that level of uncompensated care coming into the system. So there'll be more information coming about that this winter. We did just have our tribal consultation as well a couple of weeks ago that we do every year, and talked with them and with our other community partners about one of the things we all need to be thinking about is how we're using the resources each of us have to provide care for the communities that we support. So for example, we're the only level 1 trauma center. We're going to be the people really making sure that level 1 trauma is available. There are lots of folks in the community who provide primary care. So how do we make sure that we're making the maximum use of those resources and making sure everybody is participating in distributing care? So there's a lot of community partnership work to do over the next really 6 months to a year to get prepared for that change in uncompensated care. And then the last change from OBBA, well, not the last one, but for us specifically, is the change to the state-directed payments from Medicaid. UNMH has participated in state-directed payments for the past 5 years. And that change starting January 1, 2028 will be a decrease of 10% per year in that amount of that state-directed payment. So for us, that's a change of roughly $27 million a year, beginning January 1, 2028. So kind of figuring out what that looks like in the following year's budget as we start to kind of get the impact of the uncompensated care figured out and start to see what it looks like post the 2026 elections and then looking into 2028. Thank you for the question.
Thank you. I was sure you would be prepared, as I'm sure everybody's asked you that. But thank you. Great information.
Commissioner Frank Baca?
Thank you, Mr. Chair. Becker, is that correct?
Yes.
Just to make sure that I understand, the UNM CARES parameter is, well, would you just explain to me again?
UNM Care is our program for folks who do not have other insurance coverage available. So you're not eligible for Medicaid, you don't have another source of insurance through your employer, you're not insured through the exchange. So UNM Care is our it's called indigent care at other places. That's our program for that. So it's not funded. There's no funding source for UNM Care.
So it's just a catch-all category. It's not a process or application. It is just where you designate people who do not have insurance into that group. Is that correct?
Yes, sir, that is correct. And for us, it's a program that helps us support those families and those individuals because we want to make sure that we're helping them with the continuum of care. So trying to make sure that, oh, can we get you into a primary care provider maybe so you're not going to the emergency room? How can we sort of support you to make better use of that care?
I'm just kind of curious because, you know, you provide all kinds of great data here. I mean, it's really actually kind of interesting to dig into the different types of care that people receive, the different zip codes and everything. But are people that are in the UNM Care program, are they designated as such? So somebody would look at the records and say that, yeah, you're in UNM Care?
Yes, sir. So Patient Financial Services is the team that we have that when you are applying for UNM Care, they do a review of your financial documents. And so we actually did a lot of really good work probably 2 to 3 years ago now. Commissioner Barboa will remember this, with the Center for Law and Poverty, to make sure that we're approaching those applications in a way that is appropriate from a language perspective and also appropriate from how we talk to people in that process perspective. And so that team is really pretty strong in terms of how do we make sure that folks who are eligible are actually getting into the program, because we do want people to access care. That is why we're here. We're here to give health care for New Mexicans in New Mexico.
All right, thank you. So I guess so, well, so you did clarify there is a process, there is an application, and there is a list essentially. The other question, and this is just actually a relatively minor point, but it's just something I noticed that in terms of patients sent to collection, I didn't really understand. One of the pages of your submittal, in page 32 indicated shows a chart, a trend of patients sent to collections going down to essentially zero. And I saw on Exhibit A, the financial service on page 51 says UNMH will subject to CMS regulations assure that no indigent patient is sent to collections. So I think that's probably saying the same thing at this point in time. Nobody is being sent. Is that also correct?
Is there people, so if you're in UNM Care, you can't be sent to collections.
By definition, yeah. Okay. All right. Thank you.
I just want to add that.
Go ahead, Vice Chair Barboa.
That also up to the federal poverty level, there's also a Medical Debt Protections Act that.
Yes.
Yeah, so up to, I think it's 200%.
I think it's 200%.
200% federal poverty level, you can't be sent to collection.
Thank you.
Anyone else? Questions? I do have one for you, and I've asked you about this before, and I know it's difficult for you all in the administrative roles, whether it's the county or the hospital system, to comment, but where are we at with resident physicians and progress on making sure that those salaries are competitive? For me, as a business owner, it's pretty simple, right? How it's supply and demand, and if you're not paying enough, you're not going to recruit people. And when I visited with some of the physicians, I know that for many of them, UNM was their first choice. They wanted to go there for whatever reason. But for some of them, it was not. And that was a primary reason why it was not. And even for those that want to go to UNM Medical, that is a significant barrier that we are continually kind of catching up to the curve rather than at the front of the curve. Yeah, just can you comment at all on salaries and benefits? And I know you're in the struggle to balance the books, and so you've got a lot of things to juggle.
Thank you so much for that question. So recruiting and hiring residents is different than any other job interview and hiring process in the United States. So if you are somebody graduating from medical school and you are seeking to pursue a residency, in the fall, like literally right about now, you're sending out applications to all of the places where you want to get an interview. So just that seems normal. That part is normal. You get interviews at whatever places you get interviews. And then in January, you make a list, a ranked list of where you would like to go, 1 through whatever number you want to do. So generally speaking, people rank the places they interviewed, because if you didn't get an interview, you're probably not going to get matched there. But you rank in your order of preference. And there's a lot of reasons why medical students rank places in the order they do. We know what their reasons are because they get surveyed on it every year. And we know that pay is not in the top 10 reasons. The highest reason usually is the quality of the program, what they see as the program that they want to match with. But geographic location is a reason, family nearby is a reason. There's, all of the things you would think of as, why do you look at a job? So at the same time, each of the programs ranks the people they interviewed from 1 to whatever number it might be. The program and the resident don't get to pick each other. So the American Association of Medical Colleges, the AAMC, runs a program called The Match. That's the name of it. And they use an algorithm at their office in Washington, D.C. that matches up the residents and the programs. And so right around St. Patrick's Day, March 17th every year, within a couple days of that, all across the country, every program from the match sends out a letter to the individual resident. And so on that day, you open up your letter, and that's when you find out where you are going to spend the next 3 to 7 years of your life. It's not because you picked it, you did rank it, so it's probably on your list. Your first reaction is, yay, I matched somewhere, because that's really, you're not going to be able to practice if you don't do a residency. But your second reaction is, I don't know anybody in that town. I'm going to have to move there. What do I do? I mean, it is a very different process than any other job interview process in the country. So to your question, we match about 100 to 125 first-year residents every year. We have almost 800 total residents and fellows in our programs. We are actually in the top 8% of residency programs in the United States in terms of size. We have dramatically expanded our number of residents because we want people to stay in New Mexico. We want to get people here to practice as physicians. So we have about 120-ish spots for the first years. That's who's matching every year. Last year, we got about 12,000 applications for those 120 spots. We matched all of them in the first round of the match. So everybody either got a letter and matched, or between that Monday of that week and Friday of that week, there's something that in the olden days was called the scramble. Now it's called SOAP, which stands for something I don't remember. And they match people up kind of like a little second round match. But everybody matched within that first week. So we feel like we offer really competitive benefits, a competitive program. The quality of our programs is strong, and so we're very attractive to people to apply here. That said, we do want to make sure we're paying people fairly. And so what we offer is actually at the median for our region. Now, we look at the national AAMC, but we also do a survey of the programs like us, Texas, Colorado, Arizona. We do not rely on the Western region because that includes California. And the salaries and cost of living in California are substantially different than the part of the country that we are in. So a lot of times when you hear from other people about what the salaries are and where we sit, they're comparing us to the Western region. And we are not at the midpoint of the Western region. The midpoint is higher. The total range we're talking about is not a huge number of dollars. The average resident, the difference between us and another program is going to be $2,000 or $3,000 or $5,000. It's not tens of thousands of dollars across the country. They're all in pretty tight bands year over year. But we feel like we have a very competitive program with very competitive salaries. The residents actually were the only people supported by UNM Hospital who were offered a wage increase for the year we are now in, FY26. We ended FY25, as you know, with a more than $30 million deficit, and we did not budget a wage increase for any other employees. We did budget one for the residents. We have not been able to reach a collective bargaining agreement at this time with the residents. So I know that was a super long answer, sorry, but sometimes it's helpful to know it's a weird kind of job, right? I mean, the way people get the job is a weird process.
I really appreciate you educating all of us on that. I didn't understand that, how that all works, so that was really helpful. And totally understand the situation, and just want to say that I want to continue to advocate for our doctors, especially beginning in their careers, and want them to stay here, want them to buy houses here, want them to start their lives here, because we want them to continue to live here down the line and have or at least have a fond memory of the place. And so I think that's one part of it. There's a lot of other pieces that we collectively work on and others in the community, but just want to put in my feelings for them and that wage, and I respect your position, and thank you for educating us and doing what you can to keep those wages competitive and fair. So thank you.
Thank you for listening.
Anyone else? No? Thank you,
Thanks.
Dr. Becker. Appreciate it. All right, up next, we've got another presentation from the Behavioral Health Authority Division on the Opioid Settlement Quarterly, the projects and allocations, from Deputy County Manager Wayne Lindstrom.
My apologies, Mr. Chair. I picked the wrong slide deck. Now I'm on track. Thank you, Mr. Chair, members of the commission. I'm here before you this evening to report on a quarterly basis on the status of our opioid settlement funds. My name is Wayne Lindstrom. I'm the Deputy County Manager for Behavioral Health. You'll see on the slide before you that as of September the 18th, we had a fund balance of $25,517,000, $956.14. We've had a number of expenditures that we've completed. That includes the Keep New Mexico Alive marketing campaign. We fund the Metropolitan Detention Center for the Medication-Assisted Treatment Program. Our Youth Services Center does naloxone training with a portion of these funds. And we recently purchased what was the Albuquerque Indian Center property so that we could expand the tiny home village by another 18 units. And all of that is in process relative to the demolition of that facility. We had some abatement issues, and we just had a design team meeting relative to mapping out what those 18 units are going to look like and placed and the amenities, et cetera. So that leaves us a balance of $23,692,000 roughly. And if you recall from the Local Government Coordinating Commission guidance document with regards to these funds, which you approved last January, I think it was, we had $2 million set aside from the county portion for capacity and sustainability procurement. We did a intergovernmental agreement with the Albuquerque Public Schools to expand their Crossroads program and clinical services program to the Albuquerque schools, middle schools. And we also have designated a provider infrastructure procurement in the amount of $10 million, and that leaves us with roughly a balance of $6.9 million. One of the proposals that's under consideration is continuation of the Keep New Mexico Alive marketing campaign for another $385,000. Assuming that were to be approved, we'd be left with a balance of $6.5 million. Relative to the presentation you just heard from CEO Kate Becker, we also have concerns about what's happening with regards to federal funding. And the Substance Abuse and Mental Health Services Administration had 900 employees. They're down to 300. And they basically are being absorbed into the Health Resources Service Administration. And in briefings that we've received, it appears that there will not be support for harm reduction programs going forward. So being able to access naloxone, for example, and needle exchange programs and other things that fall under the definition of harm reduction, there may not be federal financial support. So as we go down this road and we look through 2038, relative to receiving on average $2.2 million, it may be that one of the things we're going to have to consider is how we fill some of those gaps with these funds. And that's why I'm bringing that matter to your attention. On the next page is a delineation between the city and the county in terms of our status with regards to these various solicitations. $2 million was designated for the county and the city for the small and medium-sized provider capacity and sustainability grants. This was a joint procurement, which was also one of the items in the guidance document from the Local Government Coordinating Commission. We opened that procurement on June 30th of 2025. It was closed on August the 7th. 21 proposals were submitted. 18 qualified for a proposal review. We have completed that review, but that occurred between the time that I did this slide and reporting to you this evening. We have completed both the programmatic review as well as the financial review, and 18 that qualified for a review. It appears that we will have 8 potential awards, and that's dependent on contract negotiations, etc. So that one is well underway. With regards to the provider infrastructure grant, that was $10 million designated for the county, another $10 million for the city. This was not intended as a joint procurement, but separate procurements, but that both the city and the county would be involved in each other's review panels for proposals that were received. The city opened their solicitation on July 16th, and that was closed on October 20th, and the review process of those submissions has just been initiated, and we released our RFP on October 22nd, this last weekend, and we'll have that open for another 45 days. Lastly was the Albuquerque Schools Prevention Intervention Grant, and that's over the course of next 3 years, $4.8 million coming from the city and another $4.8 million from the county. And that 3-way intergovernmental agreement has been negotiated and was executed on August the 26th. And the Albuquerque Public Schools is currently in the process of recruiting and hiring for the positions and the implementation of the Crossroads program and the clinical behavioral health services as well. With regards to where we are with the publicly facing dashboard, we're proceeding with financial measures, which will report on the respective appropriating bodies, the monies received, the monies expended, and our expenditure details. And then we'll have a set of accountability measures that will be aligned with our behavioral health result measures, which fall within our behavioral health strategic plan. And the ultimate question we're attempting to answer, did we make a difference with the utilization of these funds? And that will be broken down into 2 categories, one for opioid intervention and treatment client outcomes, and the others are related to prevention and community revitalization outcomes. And we have purchased and installed Tableau, which is an online dashboard platform which will enable publication across the 3 entities, Bernalillo County, the city, and the Albuquerque Public Schools. And we have regular meetings on how we're going to be collecting data and what the performance measures are, which are spelled out in each of the contracts relative to the respective procurements. And progress is continuing on that front. We will have financial measure dashboard reporting by December. And please understand that while we're doing these procurements and there's recruitment, hiring, etc., we then have to negotiate contracts and have a methodology for collecting data, analyzing data, and reporting on it. So there will be a lag between when we roll out the financial dashboard and the actual client outcomes dashboard, and that will be available, and we'll be reporting on it by the end of this fiscal year. And I will stand for any questions that you may have. Thank you.
Thank you, Dr. Lindstrom. Commissioners? Madam Vice Chair, you can start us off.
I just really wanted to say thank you for the update. Thank you for the briefing. I think I'm glad the dashboard is
underway, and excited to see all of it come together. So thank you, and thank you to the board that came last time to share. I know they're working hard on all of this.
And I might mention, Mr. Chair, that as I had promised previously, we're posting on burnco.gov as we speak our progress in lieu of actually having the dashboard itself. So the public will be able to see the progress we're making as the dashboard's being built.
Commissioner Brinkbacher?
Thank you, Mr. Chair. Dr. Landstrom, just in terms of the client outcome measurement, could you just briefly explain to me how that is? Is it based on a period of time, or how does that measure? How is that determined?
Mr. Chair, Commissioner Baca, we have performance measures relative to all of the work that we're doing. So it's not just limited to the opioid funds. And so we will be expecting reporting from all our contracts with regards to how they're performing against their scope of work. But rather than being dependent on evaluation contracts, as we have been historically, service providers themselves will have a template to report on monthly, and that will go into our data warehouse and enable us to be able to collect the data, analyze the data, and report on it. And that includes everything from meeting the expectations in goals and objectives related to a treatment plan to level of service satisfaction that they're getting relative to the service providers that they're seeing. So this is a kind of a standardized data collection, analysis, and performance reporting that we're doing for all of our work in the Behavioral Health Division, and it will extend into this particular funding pot as well.
Just to follow up on that, there was, I think, some discussion some meetings ago about, in fact, you had a couple of analysts that you had just recently hired that were going to come on board to, I think, help with the collection of the data. So, in terms of accountability, which is, I think, the most important, in my view, kind of the most important part of our job is to, there's lots of money that's out here, lots of ideas, lots of spending, but it does really come back to accountability. And as you say in your slide, are we making a difference? And so I thought there was some discussion about looking at individuals and tracking them for a period of time to determine the outcome. I mean, I've seen programs where I think that they measure the success as to whether somebody showed up for treatment and they showed up for a period of time. But as we all know, that could be very short-lived. And so I'm just curious in terms of understanding how we're going to be looking at individuals over a period of time. And I think that would also affect and inform our future treatment plans, because as we know, that relapse is a part of the recovery process. So I just really want to understand that and hope that there's really a lot of effort to looking at people down the road, down the line, 3 months down the road, 6 months down the road, a year or 2 years down the road. Are they back into society as productive, constructive members?
Mr. Chair, Commissioner Baca, you've asked a question that has plagued healthcare and behavioral health specifically for the 53 years I've been in this field. I would respond in a couple of ways. One has to do with the fact that nobody pays for longitudinal studies and evaluations, et cetera, unless you get a research grant. So the margins that behavioral health providers get paid either by us or by commercial health insurance or Medicaid don't allow them the margin to be able to do long-term follow-up. So I ask your patience relative to let's start being able to report on what we do have available to us in terms of increasing amount of data and being able to analyze and report on how our dollars are being used. And then that becomes then another question about how do we engender the resources to do the kind of long-term follow-up that you're suggesting. One of the things that we do have the capability to do is in our familiar faces data. We've been collecting that now for 5 years. If you think of the Pareto rule that, you know, the old rule that 20% of whatever you want to measure typically is consumed by, I mean, 20% are high utilizers, in this case in healthcare, and they spend perhaps as much as 80% of the resource. So we do have a database around that. And that we've been following for 5 years. These are people who have high levels of recidivism between the criminal justice system and our behavioral health system. And we are talking to UNM right now about doing what we're calling a cohort analysis, because I think for too long over the course of these 5 years, we've looked at this population as monolithic, and it really isn't. So we want to do a cohort analysis and see how we can differentiate the people who have this high recycling through the system phenomenon, and then develop individualized service packages for cohorts, do a few pilot runs at testing out these service packages to see if we can really make a difference in stopping that vicious cycle. So that's kind of a long-winded way to get at something more immediate that I think we can do to get at your basic question of making a longer-term difference.
And if I could just interject, I'm really glad that Dr. Lindstrom raised the issue about the familiar faces strategy. And what's so significant about that is that the more the staff has dug into the numbers of people that we're seeing that are really bouncing between UNMH, the MDC, and all of the services is almost 500 people. And the reason I'm saying that is that one of the reasons that I just want to reemphasize the importance of that particular program is because the folks are so high need. And frankly, they're in so many of our different databases that as we are evolving our programs, we're going to have a much better sense of how to customize services in the long run. Because one of the challenges that you're raising that I think is really critical is that we understand as service providers that we have a lot of people that we have to be able to serve over a specified amount of time with very constrained resources. One of the challenges is that we've learned, and I know a number of you have been engaged in service provision, what we've learned is that even though we have to have some standard practice, that we won't really be effective until we can customize based on what we learned, which I think is the point that you're raising. I think our first most important foray will be into this first 500 individuals that we're talking about. In addition to that, I think, you know, under Dr. Lindstrom's leadership, we're much more open to being part of any studies that folks want to help us with. But I think you're asking a slightly separate question. There's a study of how we know how many times it takes someone to get healthy, and then there's understanding how are our local programs impacting that outcome. So I think to decouple those for a moment, we have a place to start with this group of 500. On the longer term issue, I do think that, you know, part of the reason we have experts like Dr. Lindstrom and, you know, we're out in the field right now with our chief medical officer is we do want to take a better look at where are the other places within our services that we can do a much better job of tracking. And I'll just wrap up with this one point. The thing that I would say is really vexing for us is that people get into so many different kinds of services and they are in so many different databases and none of them talk to each other. And it's a really dissatisfying answer, but it's the thing that's keeping me up right now is better understanding how we take all of the data we are receiving, do a much better job of synthesizing and integrating it, and using that data to help us better understand, again, back to the point I was raising earlier about how we do a better job of providing large numbers of people with services, but in a much more customized, rigorous way so that we're being much more judicious about our services, because one of the things we know from research is giving people too little service is as harmful as giving them, I mean, we can actually overserve people too, and we have almost the same outcomes depending on the kinds of issues they have. So a lot to dive into, and really, really appreciate the question, because it's the thing we talk about and are trying to figure out with our partners.
Thank you. Vice Chair Barboa?
Hi, thank you, Chair. Thank you, Dr. Lindstrom. Again, I just wanted to comment to Commissioner Baca's question too. And that was the first thing I was thinking of too, is the familiar faces, because as you often say, Commissioner Baca, that right, the permanent supportive housing. So, and that population of those familiar faces are the ones that are most likely to need that permanent long-term housing, right? Because of multiple reasons. It's not like just solely substance use usually that those folks are impacted by. So what I kept getting at when I was first here and uncovering that there's so many, and I only under Dr. Lindstrom have we been able to say, yes, now we know there's 563 or whatever that are these folks, right? But now that we know, once we figure out how to customize, get programming that works, probably long-term supportive housing, then that 500, then we can actually use some of those resources. So much of the next layer of just substance use people or folks that are living precariously housing using substances because they're in trauma constantly or whatever, we're not able to get to a lot of that because we're constantly shuffling this same group of 500-ish people around between the systems. So I appreciate this conversation, I guess.
Thank you, Vice Chair. Commissioners, any other comments or questions? I wanted to ask you a question on the Narcan training. I do not know anything about that, but the number just seems kind of high, 300,000 for Narcan training. Is that across the county? But it just said YSC.
No, that particular item, Mr. Chair, is for our Youth Services Center. And so it's basically teaching the young people who end up in our detention center about how to do an overdose intervention using naloxone, when Narcan is the brand name for that, as well as doing other education around opioid use disorder and the dangers associated with fentanyl and other opioids. And it certainly can extend beyond the opioids as well.
So this is training for the young people in the facility, not for the staff?
Correct.
Okay, I think that's
Correct.
what my misunderstanding was. And how is that provisioned? I mean, is that 300,000 cover a certain number of individuals? Is it for a year? How does that look?
In all candor, Mr. Chair, I will have to go back and get the scope of work for you. I just don't have those details in my head.
I appreciate that. Thank you.
Sure, thank you.
All right. Thank you for your time, Dr. Lindstrom. And so up next, we've got our consent agenda. Madam Clerk, could you please provide resolution numbers for items 6B1, 6B2, 6E, 6G, 6H, 6I, 6J, 6K, and the newly added 6L? It's a bunch of them.
Yes, Mr. Chair. Item 6B1 is FR 2025-104. 6B2 is FR 2025-105. 6E is AR 2025-106. 6G is AR 2025-107. 6H is AR 2025-108. 6I is AR 2025-109. 6J is AR 2025-110. 6K is FR 2025-111. 6L is FR 2025-112. And going back, 6F is Ordinance 2025-31.
All right. Thank you, Madam Clerk. We appreciate that. The consent agenda has been published and made available to the public, and resolutions have been introduced at previous meetings as required. Therefore, I move to approve the consent agenda. Do I have a second?
Second.
A second from Vice Chair Barboa and Commissioner Frank Baca.
Thank you, Mr. Chair. I just want to make a comment, if I may, and I just want to remark about the nuisance abatement cases, that I really appreciate the work that's done on these cases in particular. I've looked at, we had a briefing on those. I've looked at the photographs which are in our pocket, and these are properties that are unoccupied, and if there was one that's unoccupied, which I don't think it is, it was by unauthorized occupant. There are properties that have been burnt out. There are properties that are public nuisances. They're just absolutely a bane to the people that live in those neighborhoods, and I appreciate the work of our staff in really setting those aside and focus on those. And I know there's been discussions with a couple of the owners to resolve those, short of us actually entering the property, which I appreciate that continued effort. And also just gives me an opportunity to just speak very briefly on something that I am still working on, a resolution I'd like to bring to this commission here in a few, hopefully in a few short months, about dealing with these and finding perhaps an alternative way to address these. On one hand, what we're doing is good, it works, but it also costs us money to go in and take these properties. There may be another way to get other people in our community to be involved in this process that would short circuit this process. And the reason that I'm interested in this, because it's not just a matter of removing the blight, but it's also a matter of replacing that blight with a productive parcel of property that could also be an affordable housing opportunity for someone. So that's just give you hopefully a foretelling of something I'm going to bring before you and ask you to consider somewhere down the line. But anyway, thank you for that.
Thank you, Commissioner Baca. Any other discussion or comments on the consent agenda? All right, seeing none, there's been a motion and a second. All those in favor signal in the affirmative. Yes?
Yes.
Any opposed? None. That passes on a 5-0 vote. There are no consent agenda withdrawals this evening. Madam Clerk, could you please provide a resolution number for items 8A, 8B, and 8C?
Yes, Mr. Chair, item 8A is AR 2025-113. Item 8B is AR 2025-114, and 8C is AR 2025-115.
Thank you, Madam Clerk. All right, so first up, we've got item 8A, a task force for speeding in Bernalillo County, and we have Commissioner Frank Baca and Commissioner Walt Benson sponsoring. Commissioner Frank Baca.
Thank you, Mr. Chair. This matter was heard at our last meeting, and I appreciate the support in moving this forward to this juncture. The question that I pose to County Manager is that I presented two options. One is for simply to have a task force with in-house, and the other is to go outside to bring in a consultant. And the recommendation from the manager was to, after talking with staff, is to look at retaining a consultant. And then the question came up, and I think thanks to Julie, her sharp eye on that, and asked the question about, is it going to be one or the other? And it kind of dawned on me that I think the best case scenario is to do both, to basically have a task force that is set up to request this study, and then have that study go back to that task force, people that are informed on the issue, that are involved in the issue, and then that would eventually be brought back to this commission for final review and hopefully adoption. But this is a large issue. It's a life or death issue. It's something that I hear at essentially every neighborhood association meeting I go to. I would ask Commissioner Benson to weigh in as well. I did, as a result of these conversations the last day and a half, about how the process will work. We did, or Julie did, create an amendment I'd like to pass out or hand out. And one of the amendments, as you will see as we're passing out, is to increase the time of the report back from 120 days to 180 days. I'll give a chance to review it, and then I guess I would like to move the amendment as stated on the document that I'm passing out.
Mr. Chair.
Go ahead, Commissioner Benson.
Thank you. Commissioner Baca, I agree with all of the changes that you discussed here and that you and I discussed prior. This amendment, I don't see the consultant aspect of it. Just the task force. Unless I'm missing it. And then in that case,
I think
I
you're
think
correct.
if we can take the number one of the following section and move it up to a new point 4, and then the new point 4 would then become new point 5, and then the new point 5 would become new point 6, if that makes sense. Because I agree, I like the idea of an outside consultant. I think we need it. The whole kind of our goal up here has been to look around the country to see what else is working. And however, if a consultant isn't local, they may not really understand our culture, and what might work in my district might not work in District 5. And so that's where I think the task force would come in handy. But if I might, Commissioner Baca, amend this one last time to move point 1 up in between points 3 and 4. I think that would get us to the point where we had discussed.
Good catch. Thank you.
Okay, so to restate that, I think the stricken point number 1
Correct.
would become number 4, and then renumber following.
Perfect.
Okay.
Yes, Mr. Chair. Oh, and Commissioner Baca, do you want to make a motion for this?
Yes, I would move the amendments as stated by.
All right, so first process, you need to move the underlying
Okay,
resolution and then the amendment.
thank you.
So,
I'd move the resolution to establish the task force for speed in Bernalillo County as yes.
Second.
and a second from Commissioner Benson, and then if you want to move the amendments.
Thank you. And as per the discussion and the amendment, including the inclusion that Commissioner Benson caught, which was to include what was number 1 had been stricken out, to move that up to number 4. I would, yes, I would move that amendment as discussed.
Second.
And a second from Commissioner Benson. Any discussion or comments on the amendment? Seeing none, all those in favor of adoption of the amendment signal in the affirmative. Yes?
Yes.
Any opposed? All right, the amendment's adopted on a 5-0 vote, and now we're on the amended resolution. Any comments on that? Vice Chair Barboa?
Yeah, thank you, and we've talked about this before. I'm interested, I guess you spoke a little bit to it, saying that we were interested in hearing what other places are doing. I guess that was gonna be my questions, like what do we anticipate getting out of a study that we might not know? Or do we anticipate that there's things out there that are actually helping that we don't know about? I guess, yeah.
I can speak to it, or unless Commissioner Baca. So I think the answer is yes. But it's casting a wide net to see what is out there that we're not doing. The speed cameras have worked, and we may add more of those. But instead of just focusing on that, what else is there out there? It's primarily with technology or maybe ordinances, and just to see what's working in the effort to reduce speeding primarily. And again, primarily not for speeding's sake, but for safety's sake. And then see what is working and why it's working. Because why it's working may or may not work here. And so it's really an exploratory session to see what else is out there and what we might be able to implement.
I think DCM Archuleta might want to jump in.
Mr. Chair, Commissioners Frank Baca and Commissioner Benson, we actually, since last meeting, have made contact with the Texas A&M Transportation Institute, and in their Center for Transportation Studies, this is what they specialize in. And in an email exchange we had, they have mentioned that they are willing to help. This is in their area, and that they've been actually tasked by the Maricopa Association of Governments, which is similar to our Council of Governments here, for a similar study that they've been experiencing the same thing. Where they're a bigger urban area and such, it's showing that, like you guys are saying, this is a larger issue across the nation, and so they said they're well prepared and to join in our effort in there. So from a timeline perspective, we do have the ability through our existing engineering on-calls to subcontract to them as part of the team. So in the next week, we'll be providing a white paper to you two commissioners on our approach on how we want to, first off, who we want locally on the task force, because in the resolution you wanted us to reach out to City of Albuquerque and also other local governments. We know the Village of Los Ranchos is also experiencing similar problems for this, and we also have Village of Tejeras in the East Mountains and areas in there. So we want to cast that net because we do see this everywhere. So we want to get the recommendations. We'll provide recommendations on who to involve for you to essentially bless for us as we move forward in forming that internal task force. But in the meantime, we'll concurrently be reaching out for a proposal to get the consultants on board.
All right, Commissioners, any other discussion or comments? Either of the sponsors want to close?
Just thank you for your support of that, and hopefully, and thank you for being proactive in that regard, in that research, because that's exactly what I was looking for, collaboration with various entities, bringing in experts, and ultimately it is going to be a matter of a new technology that is, on the drawing board or just being tested and who knows where. So yes, I think it's a really important initiative, and appreciate your support of this solution. Thank you.
All right, with that, we'll close the floor. All those in favor signal in the affirmative. Yes. Aye. Any opposed? All right, that passes on a 5-0 vote. Thank you, Commissioners. All right, up next, we've got our Capital Improvement Program, 2026 House Bill 2 and Legislative Priorities of New Mexico Counties. And we have Ms. Kathy Court to present.
Good evening, Mr. Chair and Commissioners and colleagues. Before you this evening is a motion to approve an administrative resolution supporting the House Bill 2 and legislative priorities endorsed by the Board of Directors of New Mexico Counties. This was introduced to you in the last BCC meeting on October 14th. Just an overview again, a reminder of what we're doing here. New Mexico County serves as a statewide voice for all 33 counties. Each year, the organization's Board of Directors does approve the organization's House Bill 2 and legislative priorities for the New Mexico Legislature's annual session. Bernalillo County's elected official who sits on the Board of Directors is Assessor Damian Lara. Outlined in the resolution for you are the priorities here on the screen. Detention Reimbursement Fund, continuing to fund our Detention Reimbursement Fund. More funding for courthouses, and that means infrastructure and improvements at all of our courthouses statewide. Again, another request that the state pay for the subscriber fees for 700 megahertz radios, and for continued funding for detention, firefighter, and EMS recruitment and retention efforts throughout the state, and RISE funding. Other priorities listed in their resolution is an IPRA. It's a very general statement about IPRA improvements, and the property tax exemptions deadline for veterans is also on their priority list. As mentioned, At the last meeting, we did get feedback from our staff, and so you do have a document as part of your package with feedback from the staff and their recommendations. For the most part, we're supporting all of these initiatives, and as far as the IPRA improvements, as mentioned last time, we would follow any statutory requirements around IPRA. And so, again, here are those, the staff recommendations based on the feedback that you have in your packet. And next steps would be that we would share an approved resolution with New Mexico County's executive staff. And obviously, we do coordinate with them throughout the session and, you know, attend their morning meetings and just kind of know what's going on with them and share ideas as well. And I stand for any questions. Thank you very much.
Thank you, Ms. Court. Any questions, commissioners? Anyone want to make a motion?
Move approval.
Motion to approve from Commissioner Barbara Baca. I'll second. Second from the Vice Chair. Any further discussion? Nope, seeing none. All those in favor signal in the affirmative.
Aye.
Any opposed? Nope. And that passes on a 4-1 vote. And so up next, we have the item 8C, the Bernalillo County House Bill 2 and policy priorities for the 2026 regular session of the legislature. Ms. Court again. And we also have our whole lobbying team here with us.
Yes, I was going to start off by introducing our lobbying team. They're so generous to be here tonight with us and with you so that they can answer your questions. Joining me up here on the at the speaker's podium is Matt Munoz. He really is focused on capital outlay priorities, but he's also very knowledgeable about a lot of the other issues going on at the state. Ricky Lee Chavez is also here with us. She really focuses on criminal justice and behavioral health issues, but again, she's another knowledgeable player with what's happening in Santa Fe. And then finally, Dan Weeks, the renowned Dan Weeks, who knows everything about finance and policy at the state level. So with that, I'll go through the presentation for you, but I'm very happy to have our lobbyists here to help answer any questions that you might have in the course of this presentation. So the purpose here tonight is to ask for your approval of an administrative resolution that establishes Bernalillo County's House Bill 2 and policy priorities for the 2026 New Mexico legislature. As part of your packet, you have the original version of the resolution, as well as Commissioner Chair Olivas's recommended changes outlined in his resolution. So we have both of those for you in your packet. As an overview, we've got House Bill 2 funding priorities listed as housing, youth adjudication facilities, adult jails, and public safety infrastructure. We're looking for more House Bill 2 funding to help us support our public safety facilities and, of course, to continue the efforts that we're making in the housing arena. Secondly, we've got housing programs and services, supportive statements for housing programs and services, including the low-income housing tax credit and New Mexico Affordable Housing Tax Credit, supportive housing and wraparound services, capital funding strategies for land grant residents, and integration of housing planning and environmental sustainability. In the public safety realm, we're supporting youth continued and improved and expanded youth rehabilitation and wraparound services, funding for local governments that operate jails and provide programs and services to incarcerated individuals who suffer from severe mental illness and substance use disorders. In our healthcare component of the package, we are supportive of funding and expanding early intervention programs addressing workforce shortages by streamlining licensing processes and approving interstate compacts, and funding to UNM hospitals to increase wages for resident physicians and fellows. In our economic development, education, and workforce development section of the resolution, we're supporting property tax reforms, additional New Mexico Department of Transportation bond capacity for additional construction and rehab of state and local roads. And we're supportive of enhancing tribal education programs and pipeline programs for jobs in healthcare, renewable energy, and infrastructure fields. And finally, in capital outlay, we're supportive of expanding the Capital Development Program Fund. By the way, we just won another grant out of that fund, so it's a very, very good program. Our next steps upon approval of this resolution would be, of course, to share this resolution with the Office of the Governor and our House and Senate leadership, and it's something that our lobbyists also use as a guidepost for their work at the legislature. So with that, I'm going to stand for questions, me and my fellow team members here. Thank you so much.
All right, commissioners, any questions for the team? Yes, Vice Chair Barboa.
I don't have any questions. I'm just, really proud of this consolidation and really focused list. Feels good. So thank you all.
All right, so I'm gonna make a motion to adopt the amended version, or the version that was labeled in the packet as the EO version that was introduced on the 14th.
It's item D in the, it's item D in the packet. I second that.
Thank you. So there's been a motion, a second, and the version I just passed out is the same as what was in the packet, as the same as what I passed out on the dais last meeting. So, and I think much of that was incorporated into Ms. Court's presentation, so.
So it's aligned.
I would say so.
Say that again, I'm sorry.
I'm sorry, I asked, so it's aligned with what we're seeing in our packets?
Yes.
Yeah, I just reviewed.
Madam County Manager, and then we'll go to Commissioner Baca.
May I make one comment? Well, two, actually, sorry. One is, I just wanted to say this was a new process for us. So one of the things that we're going to want when we do our one-on-ones with you is your feedback on how this process worked, because what we're trying to do is do a much better job of engaging you and thinking more about what your interests are. And I just wanted to say to Kathy and the staff, what a fantastic job you did, both getting information and working with our lobbyists. And just to make this observation that I got feedback, one piece of feedback I got was that the staff, the lobbyist team did such a good job of going into every meeting and looking at every issue that was being raised, and every one of those issues was brought to you to rate, irrespective of whether or not it was a core function of the county. And so I know a number of you raised concerns with me about, well, it may look like we don't care about, education, or we don't care about the arts, or whatever that issue is. And that was really not the intent, but the intent really is to be able to make sure that you have as much information as possible and that you're able to give us feedback so that we can prioritize our efforts over the course of the legislative session. So any additional feedback, feel free to give it to us, because we're going to keep improving on this process. And to that end, we're going to begin our legislative process, as a reminder, at the closure of this 30-day session. So we will be beginning, when we're voting on the budget in April, we will also be beginning our legislative process then, because the goal is going to be able to give influence to all of the committee meetings that happen over the summer with your input, so that we're not only reacting to what we're learning, but that we're actually putting whatever initiatives and issues that you have on the table. And I think the budget process is a really good opportunity to elicit some of those concerns and ideas that you may have. And I'm going to work closely with our team up here, because in some instances, the issues that we're really going to be concerned about aren't financial. They will always be financial. I want to be clear about that. But a lot of it is rule changes, red tape cutting, getting us the resources we need faster. I think that what we've seen with the revenue that we received from the state was such a good model for housing on how we could move processes much more effectively. And we'll know more, again, because we're going through that process, and again, we're going to learn while we're doing. And I want to just affirm that that's going to be a new change for us. So what it means for the team is that we're going to be moving a whole lot of activity up much sooner in the calendar year, spreading it out a little bit, but what we hope with the outcome of being able to lead on issues that we think are important. The only other thing I wanted to add is I did want to, there was one question that came up in the last meeting, a little bit about how, and what we think may be happening relative to revenues in the new session. And I wanted to make sure, well, maybe I should ask it this way. Did everybody get their questions answered about the document in front of you? And I'm only asking because we have all of the folks who wrote it, helped us write it, or gave feedback, both to the staff and also to all of you. We're good? Okay. Thank you. Thank you for letting me weigh in.
And before I jump over to Commissioner Barbara, I just wanted to say on that process question, because I think there was some very valid points raised about, how did this get in here? Where did this come from? I've never seen this before or heard of this kind of thing. I think it actually speaks to the process that is perhaps imperfect, but the conversation that I had with the county manager regarding that was that the process was blind really throughout. In other words, we didn't have staff deciding this isn't important, but this is, right? So we were just given the raw list of, hey, these were all the issues that we're hearing, that we're seeing from our lobbying team. And then we all had the opportunity to rank those issues. And so there was some things on there that perhaps we had never really heard of, or never, we may have heard of it, but we've never thought about it, or we've never had formal conversations on this dais or with our staff. But through that organic process and ranking those things, which the 5 of us did, those issues rose to the top for whatever reason. And so I think it was a testament to the fact that the process wasn't heavily filtered. Nobody was putting their finger on it and saying, yeah, we're only going to look at fiscal issues, or we're only going to look at issues that are related to the county directly. It was very open. And, certainly I think we could have the question of was it too open? I don't know. I think we can talk about that if folks feel that it was, but, Mr. Weeks, yes, go ahead.
Mr. Chairman and members, I just want to point out that this is a living document. It's really great that you're doing it at this point in time. Gives us a lot of time to start working with legislators and with you all and with the governor's office. But the interim committees are not yet finished. They'll finish up probably toward the middle to the end of November. So those recommendations will be coming out. We also don't know exactly what the revenue projections are going to be. There will be some changes. I know from experience that I think things are leveling out, so there's not going to be a ton of money the way there's been in the last couple sessions or several sessions. So just treat this as something that may change from time to time, either on the fly or formally, but it does give us a good template to get a good start a little earlier than we've been able to do that in the past, so thank you.
Thank you, Mr. Weeks. Commissioner Barbara.
Thank you, Mr. Chair. Yes, I'd like to thank the whole team, the lobbyists and Ms. Court, and for the process and county manager. I also want to make a statement about, I think the fine tuning and giving us that additional, in this case, Commissioner Benson, it's really important that we had a resolution that we could introduce, then think about, then amend, because I do think that this amendment that has been moved here before, or I guess it's not an amendment. What has been introduced, yeah, it's a substitute, floor substitute, I think is stronger and better because we all, came together. I really do think that it's a stronger statement for our county moving forward as we lobby the legislature. So I just wanted to say that. Thank you.
Anyone else with comments or questions? All right, not seeing any. One more time, I'll just say thank you to the whole team that worked on this, and I know it was kind of a new process. So obviously as Mr. Weeks said, not only is it a living document, but it's a living process, really. Next year we can make tweaks and change it and try to do better. And I really do agree with what Mr. Weeks said about this. I think we all should be willing to bring amendments to this. And my understanding of the rules of procedure of the commission is that during this term of the commission, which doesn't end until January, we can bring an amendment at any time to an item that has been before us, as long as it's properly noticed and all that. But it wouldn't, the two meeting requirement wouldn't apply. So if something comes up, if we see through the interims and, you know, they're wrapping up their business and we see something that we think we want to take a stance on, it's important, it's pressing, any of us can bring that, or county staff. So I just think it's important that we use that tool if need be, and give that direction to our team. So with that, we'll close the floor. And yes, Madam Vice Chair.
Well, sorry, I just wanted to actually ask the county manager, because so we're in a new process and new things, and I like it. I think this is a great list, and I appreciated and the ability to rank. And just to Mr. Weeks' point of like that things happen on the fly, I think I can get to January, but what's the process during session when things get icky and they come to you with like, this is happening that might harm the county or might benefit the county?
Thank you very much through the chair for the question. I will say that one of the balances that we're going to have to look at is how to use the guidance in a way that allows us to act in real time. And that was a challenge for me the first year because the list was so constrained that I felt very nervous. Like I know I called, I actually called a number of you to say, does this mean we're for this, and is it okay for us to engage? So I think that the framework that we have is what's really important, and I think this will be important as we move forward, is better being able to align the values of the commission with the action that are happening in real time. And Chair Olivas and I had a very interesting debate about, in a good way, about like, you can't have something so blanket that we're not representing the wills and wishes of the commission. And at the same time, we know there are certain areas that we look very carefully at. And an example was the commission gave us direction on family medical leave in the last session. We were going to support it. It was in our directives. And at the same time, if there was something that was going to harm the county budget and our ability to bring in revenue to provide all the services you're asking for, you know, us being able to balance and say, well, this is not a priority of the county, and it could negatively impact the revenue or resources that we're able to bring to the county in family medical leave, as you know, would have an impact. But you all said on this one, we want to lean in. We're ready to be part of the team on the impact. On other issues, I would want more flexibility to be able to look at that and say, okay, this was not a directive of the commission. We got to bring that back if there's some negative input or some negative legislation that comes forward. So what I think that means is as we go through the process, we start to shape more that our values alignment with the policies that you're asking us to work on, that where that's clear, we move. I will check in always with the chair and the vice chair. That's part of the role I think that you play on behalf of the commission, just to make sure I'm understanding the directive of the commission. Where we're not sure, or where one of you feel really strongly about something, I think being able to put something on the agenda, and even if that means putting during that time, because of our new rules about how early we put things on the agenda, that we leave a standing item that allows us, if we need that standing item, to put something in, even if it happens, you know, late on a Friday, but still meets the deadline or Saturday even, but still meets the deadline for a Tuesday publication, because we don't have an option. So I think we can be more flexible. And like I said, I think our team's been amazing. I think we're staying really on top of the legislative activities. So I think as we continue to move through this process, we'll understand that give and take a little bit better. Thank you.
Ms. Court?
Ms. Chavez wanted to add a little bit of a perspective to this 30-day session, and it might be helpful for all of us.
Excellent, thank you.
Mr. Chair, Madam Vice Chair, to your question specifically, I think the process that the county manager has led us on is actually going to have a really great ability to be tested in that we're heading into a 30-day. We're going to see a proclamation from the governor at the start of that 30-day. That is a Tuesday. And so as the county manager recommended, if you had a standing item, we would get that proclamation, and then you would be able to see if your resolution aligns with what has been outlined on that proclamation.
Thank you.
And I'll just take the opportunity to say one other thing about that process, not only, and maybe it's something we want to formally do, but, you know, maybe something that we want to formally designate a role for the chair and vice chair, or maybe we want to designate another vehicle. And so I'll just suggest that I'm not super familiar with it, but I believe at the city of Albuquerque, they have a group that they call the IGA. It's the, maybe it's not the IGA, but it's a committee of counselors as well as the CAO, the mayor in theory, as well as their lobbying team, federal and state, that get together, and I believe they meet weekly during the session, or maybe even more than weekly during the session, to discuss issues, discuss what's going on, and be able to perhaps react in a little bit more real time. I mean, there's always trade-offs with that, right? Because then if we've got the lobbyists in meetings with us, then they're not in meetings with the legislators. There's trade-offs there, and same with commissioners and management. But I just wanted to suggest that there may be, I just think no matter what, these meetings are not, we have some degree of flexibility, but at some point when, you know, committee agendas often are not even set the day of, frankly. You know, something's on the agenda and it doesn't get heard, or it's way at the bottom, you don't think it's gonna come up, and all of a sudden it's the first thing, right? And so, like, these things are, there is no way that on a OMA meeting schedule we can really be reactive to that. I think we can be as close as possible on the big stuff, but when it comes to little things that come up, I think we have to design some kind of vehicle, whether, again, it may be as flexible as just saying the chair and vice chair, hey, we're elected by our peers to that role, but I'm not saying that that's what we should do. There's other vehicles, like I said, the city has this committee. There's probably other stuff out there, but it may be something we want to think about formalizing if we want to be more engaged in that process. So, Madam Vice Chair.
Thank you, Chair. I like that idea, and I like the idea of being closest to it. But just to also say that, you know, every piece of legislation has to be filed, so we at least know that it exists, whether it's heard on that committee on that day that it says it is going to be, or yes, that's to the privilege of the chair to move around. But we do know when they're going on. So I think, yeah. But I do think like for my team, we do a little 30-minute call on Monday morning to make sure there's not any fires or kind of stuff like that.
I should also just add that we do meet, they probably feel like all the time. So what happens is I'm communicating with them and then I'm reaching out to you. And part of and we do have some set meetings, but you know, so just so you know, we're talking pretty constantly, and I'm meeting with them. We hope, well, and we will do that obviously every week and probably more frequent in the 30-day. And Kathy is talking to them and to our staff constantly during that time so that we can get, whether it's testimony or letters or any of that. So just know that we're doing that as we speak. And like I said, I reach out to you when something is not clear to me about the direction we should be taking.
Mr. Frank Baca.
Yeah, Mr. Chair. You know, another option might be to have sort of a standing working session on a Monday morning at 9 o'clock or Friday at 5 o'clock or whatever time. And, you know, it doesn't necessarily mean that we have a quorum. Doesn't necessarily mean that people will be in person. Doesn't necessarily mean people can be available to Zoom in. But if you know that it's a standing meeting, if you're available, you're there. If you're not, you're not. A working session is not going to be something that's going to be a formal vote. It's going to be a discussion, but I think it gives some feedback. And I think it would give us all the opportunity to have a little bit of a input into that process. And if we can't make it, we can't make it. If we can, we're there at the table.
Thank you, Commissioner Baca. Any other comments? I think we got some options that we can certainly work through, and we'll have further conversations because we've got decisions to make, maybe.
Mr. Chair, just
Commissioner Barber.
not to beat the dead horse, but the most important thing, in 30 days, we just have to be communicating. And we just want to be part of the communication. So, thank you.
Good point. All right, with that, I think we're safe to close the floor here. All those in favor of adoption of the substitute version, signal in the affirmative. Yes?
Yes.
Any opposed? All right, we have legislative priorities. So now they can go to work. Go to work anew, we should say. We know you've been at work already. All right, I believe that's all, or no, I'm sorry, we have one more business item here under approvals. We've got our Behavioral Health Authority Division, Senate Bill 3, Behavioral Health Reform and Investment Act. We have Dr. Wayne Lindstrom.
Mr. Chair, members of the commission, getting old has its liabilities, and being able to see this small print is killing me over here. My apologies. Mr. Chair, members of the commission, my name is Wayne Lindstrom, Deputy County Manager for Behavioral Health, and I'm before you this evening to consider a motion relative to a new opportunity that we just learned by virtue of attending the third meeting of the Executive Committee for the Behavioral Health Reform and Investment Act. As you may recall, there are three major goals associated with this act: to increase community engagement, enhance capacity, and to assure greater sustainability statewide for behavioral health services. And this involved the passage of a behavioral health trust fund, which is anticipated to produce a dividend in 3 years' time. And then in House Bill 2 was a measure for gap funding for $160 million until the trust fund produces a dividend. And there was a considerable amount of debate when this legislative package was being debated in the last session. And initially, this measure was solely in the domain of the administrator of the courts. And the compromise was reached that the administrator of the courts would be responsible for the regional planning provisions within the legislation, and that the healthcare authority would be responsible for the fiscal management. The executive committee membership appears in the slide before you, and I might also mention that Esperanza Lucero has been designated the Behavioral Health Integration and Reform Administrator under the AOC. And we have reached a number of milestones thus far in working with the administrator of the courts. On this slide, you see some of those milestones. We have been designated as the entity responsible for regional planning, and our region is Bernalillo County, and it aligns with the boundaries of the 2nd Judicial District. And this whole measure really focuses very much on the intersectionality of behavioral health and criminal justice. But it was also clear in the session, as well as in the subsequent meetings of this newly formed executive committee, that not everybody that has a behavioral health condition is in fact involved in the criminal justice system. And this regional planning also focuses on what's called the sequential intercept model. It's a mapping project, but it was developed for the criminal justice system and behavioral health intersectionality, but for adults. And we've done a lot of work on adults historically in this county, and where we see the biggest gap is the planning for children, youth, and families. And we've got basically the endorsement from the executive committee that that is our major focus for our regional planning. It's expected that we work with the Consortium for Behavioral Health Training and Research at UNM. They've been contracted with providing the technical assistance relative to this planning, and we've had an initial meeting with them. And it requires that there be a 2-day regional planning session. And in addition to that, 2 listening sessions. And we're launching the first listening session for this Thursday. The 2-day planning will be in November, and we'll have a subsequent listening session, and we'll send you the particulars and the links for those as well, should you care to participate. So we're putting together the invitation list for this 2-day session and the venue, etc. It's expected that when we complete this process, that we have a report, and that we, in this process, identify 5 major priority areas. And once that's done, develop a plan around what kinds of services in each of these 5 priorities do we have identified as a significant need, where there are gaps, where there hasn't been development of a particular program around a special need. And then we submit that to the executive committee for approval. Once that's done, then that makes us eligible for tapping into that initial $160 million. Should you ask questions later about details around how this is all going to work, I'm afraid I'm going to have a dearth of answers for you because the executive committee, in working with the administrator of the courts and the healthcare authority, is still trying to map all this out and how we're going to access these funds. We did receive approval to receive $60,000 from the administrator of the courts for doing this regional planning. And we have an IGA that's going through the process right now so that we can draw down that $60,000. Whether that's going to be the method for some of this other funding still remains relatively unknown. Relative to what we are requesting this evening is we learned in the last executive committee that there's a lot of expectation that these funds get dispersed rather than waiting for months of planning, if you will. And so there was an announcement that we could be eligible for $2 million or more in one-time money only in each of these 4 areas. Residential treatment, including transitional living, crisis response, medication-assisted treatment for those who are justice involved, and prenatal and perinatal substance use disorder. So what we're asking you to entertain this evening is to approve the submittal of an early access regional planning grant application. And I just learned today that that will not be submitted to the administrator of the courts, but to the healthcare authority. And I don't know if that requires you amending this language. And secondly, that you authorize the county manager to accept, appropriate, and budget funding received from the Early Access Regional Plan Grant exceeding the monetary threshold of $300,000 and any subsequent amendments in accordance with AR 2023-77. And I stand for questions.
I so move.
All right, I'll second. Let's go to motion and second and open the floor. Madam Vice Chair?
Thank you. Thank you, Dr. Lindstrom. I just had a couple of questions for my clarity. The retreat that you're talking about, that's part of the requirements to be in this process, is who attends this retreat? What's the response?
Mr. Chair, Commissioner Barboa, I understand your question. You're asking who's going to be invited to attend?
Yeah.
Yes, we're working on identifying an invitation list. So, for example, we've had meetings with the Department of CYFD, Children, Youth, and Families Department. We're asking our friends at the Albuquerque Public Schools, other trade associations, community groups, et cetera. We're going to have some limitations in terms of capacity, if you will. So we're hoping that because the listening sessions are virtual, that people that aren't able to attend the actual two-day regional planning event, we can get inputs from them pre and post on the listening sessions as well.
And that was, thank you, if I may, that was my second question is the listening sessions, can you give me more information about the listening sessions? How they'll be held and how people will know about them?
I'm going to refer to Dr. Neeser, who I have here in the audience, and she's handling all of these logistics.
Thank you.
Dr. Neeser.
Hi, Doctor.
Hi, thank you, Mr. Chair and Commissioners, and Dr. Lindstrom. I guess maybe just to take a step back, the event is the eSIM event, and so if you hear it talked about, that's how it will be discussed. So it's an enhanced sequential intercept model event that we're required to host. As Dr. Lindstrom said, we've done a lot of work on the adult population since 2019. I think we have 5 or 6 different reports out for a SIM, gaps needs analysis, strategic plans, et cetera. So this eSIM event, we're actually focusing on children, youth, and family. So that event will come out with 5 top priorities for that group. We'll then have 5 top priorities for the adult group that we'll work through with a committee that we're required to establish. And then we'll come up with those 5 that are lifespan oriented, which is what's required for the regional plan. So that's one piece of it. The listening sessions are all public. The timelines are really, really tight. And so some of this stuff is happening really quick. We just did our PSA for the first listening session, which Dr. Lindstrom said is this Thursday from 5 to 6:30. They'll all be virtual and Zoom oriented to try to access the most amount of people that we possibly can from the community. A part of SB3 is transparency and community involvement. And so we're trying our best to source as many voices as we can from the population. The eSIM event invitation list, we received sort of a template from the administrative offices of the courts as ideas about who they'd like to see. It includes local and state government, and then a plethora of other people. So we have the law offices of the public defenders, CYFD attorneys, the district attorney's office who does children's court judge, NAMI, New Day. I mean, I could go on and on, right? So like we've talked to a lot of people, but what Dr. Lindstrom said is true. We're limited in capacity just due to the way the event is run. And so again, we'll have that report probably 2 weeks post the event. Bernalillo County is also putting an SB3 web page up on the behavioral health website, or at least portion of Bernalillo County's website. And so that you'll have access to all of the documents. And so again, we're trying to be as transparent as possible as how this is all working.
Thank you. Very good information. Can I ask one follow-up question? Just when you say how the event is run, does that mean that somebody else is running it, like facilitating in a particular way or something?
Yes, Mr. Chair and Commissioner. So UNM has been tasked with facilitating the event. Like Dr. Lindstrom said, sequential intercept model was developed by SAMHSA. They have national facilitators that go around. We've actually utilized and have some of the administrative offices of the courts staff trained in that. What we don't have is a children, youth, and family version of that. And so UNM has been racing against time to figure out how to do an eSIM for children, youth, and family, and Bernalillo County's the pilot site for that for the rest of the state. And so UNM's coming in to facilitate that whole thing. They've given us an idea of between 60 and 70 attendees, 70 being like really the max in order to get the discussion that we really want to have to break some of this stuff down.
With breakout groups.
Yes, with smaller breakout groups over the 2 days.
Wonderful, thank you. And my last question, I think, is just we're still at all of this for a potential $2 million?
So, Mr. Chair and Commissioner, that's a really good question. The Early Access Planning Grant, that was announced at the last executive committee meeting. They've had multiple meetings. Nick Bucas, the director of BHSD, confirmed that that will be happening, but we still don't have any information about it. So the early access is separate from the total regional planning, and that's trying to just get money out the door in FY26. So that we're not sort of like wasting time and we can target projects that are ready to go and are urgent.
Wonderful, thank you so much, both of you.
Any other questions, commissioners? All right, thank you very much for your presentation. And Mr. County Attorney, do we need to do anything with the motion?
I think maybe it's a good idea to say and/or healthcare authority. Was it healthcare authority, the application too? Just make it clear on the agenda what you're voting for.
Okay, so the suggestion from legal is that we amend the motion, or I'll just say revise the motion to approve submittal of the early access regional plan grant application to the Administrative Office of the Courts and the Behavioral Health Authority.
Second.
Okay. All right. Any discussion?
And Madam Chair, apologies, or Mr. Chair, apologies for the interruption. If we could amend a little bit further, because we don't have an actual application attached to the agenda item, it should read authorize the county manager to submit the grant application.
Okay. So I'll restate the motion one more time. Authorize the county manager for the submittal of the Early Access Regional Plan Grant application to the Administrative Office of the Courts and the Behavioral Health Authority.
Second.
All right. Seeing no further discussion, all those in favor signal in the affirmative. Yes?
Yes.
Any opposed? Passes on a 5-0 vote.
Thank you.
Thank you, Dr. Lindstrom. All right, our next commission meeting will be Tuesday, November 18th, 2025, zoning meeting at 2 p.m. here in the Ken Sanchez Commission Chambers, followed by a Board of Finance meeting at 4 p.m., followed by the main administrative meeting at 5 p.m., all those on November 18th, 2025. Seeing no other business, this meeting is adjourned.